Okay, I'm here with one of my patients today who came in a totally changed new lady, and I asked her if I could just video her because what these changes are pretty remarkable. And unless you hear her actually saying it, you may actually think that it's just not true. So she's allowing me to video her today, and she is 66 years old. And when she first came to us, she was depressed. She had low energy, very low libido, as well as, get this, she just would never leave the house and she would just stay in bed all the time. And she came here thinking that maybe we can help her out. So I reviewed her blood work and her hormones, and she has had some other medical conditioning, including psoriasis, and we put her on a bioidentical hormone program. And now it's been about 6 months since she's been on things. And let me ask you, how are you feeling?
I feel like it's entirely new person. I never thought it would be possible because I was sort of at the end of my rope, and I didn't know which way to turn. And I thank God that I found your office because I feel like I have a new lease on life again. That I'm doing things, I'm getting out of the house finally, and every member of my family sees a difference in me. My sons, their wives, because I missed most holidays because I didn't feel like getting out of bed. And
Did you ever see a psychiatrist for all these years?
no, I didn't. No.
But
Just my regular MD at the time. She says, it's normal to go through this. You're getting old, and this is what you should expect.
Yes.
And
yes.
I go, but how many people who are my age, they have a totally different outlook on life. I go, what's missing? There's something in me that's missing. And I couldn't pinpoint what it was. So I felt resolute. I go, I'm just going to just live my life out the way I've been doing, a hermit in my own house.
And that is so true, and so true. And you came in here today and with a smile from cheek to cheek and just so elated, the way you feel, that I said, I have to ask if I could just video this because other women will not believe this. Because seriously, what you're describing is pretty major clinical depression. Just no drive, no ambition, to miss all events and just stay home. That's depression at its,
And for a
it's very
doctor
worse.
to tell me that it's normal.
Normal.
Yeah,
it's normal
just
to, and it's just your age. Absolutely unbelievable. And we did your blood work. We followed up on your numbers. Your numbers look good. Oh, by the way, tell us about psoriasis. What was going on with that?
I've had psoriasis and migraines since I was 5 years old. They came on at the same time. So since 5 years old, I've been on all types of medications for that, and it was just something that I just had to live with until I found a dermatologist, who gave me the Enbrel, and then I was on Imitrex for my migraines, which I was getting migraines 4 or 5 times a week. So
from the medicine.
From the medicines or whatever it was, but I think I inherited the migraines from my mom because she had. Back then, they didn't call it migraine; they just called it a sick headache. But ever since I've been on Dr. Rand's program, my psoriasis cleared up. I haven't had a migraine in 6 months. So I'm off that medication, so I don't need that anymore. And now I feel like I'm just starting to feel like my old self again,
Yes.
my young self again.
Yeah, absolutely. And you look so energized and like honestly a different person. To go from one extreme to another extreme, really amazing, really amazing. Well, I made some small changes today in your medications, your bioidentical hormones. I'm adjusting some dosages for you just to, get you even feeling a little bit better. So small changes, and you'll be seeing that in a day or two when it comes to your house, okay?
Okay.
All right, well, thank you very much. I really appreciate you taking a minute to do
You're
this.
welcome. Thank you.